Welcome, you're watching Living with COVID. I'm Rishika Barwa. This is a show where we talk about grappling with the new normal and how we can continue to lead our lives in the midst of the pandemic. We're joined by a panel of expert doctors who will be answering a whole host of questions. Dr. Neeraj Sinha, consultant endocrinologist, is joining us from the Paras HMRI Hospital in Patna. We also have Dr. Prabhakar Shetty, he's the chief of cardiology at the Interventional Columbia Asia Hospital in Bangalore. I want to begin by asking, if I can, Dr. Sinha, are PPE kits to be used by all staff members of clinics and OPDs in hospitals? How do these kits actually protect the person who's wearing this? And the reason I ask this question, Dr. Sinha, is because there's a lot of apprehension amidst patients who are suffering from other chronic infections to go and seek treatment.
Actually, these PP kits are absolute necessity for those who are involved in intensive care of the patient. But when we talk about those personnel who are sitting at OPD staffs, actually they also require these protective gears. At presently, they are wearing these protective gears that includes sterilized gowns, surgical gowns, gloves, mask, and face shield, apart from head cover. It has got actually three actions. It acts as physical barrier to aerosols. It instills confidence among patients that when they are visiting the OPD, they do not have to worry of combating infection at OPDs. As the patients learned from doctors and these paramedical staffs, not only about medicines, but also about the lifestyles, when they see these personals in protective gear, they get a pictorial message that we have to protect ourselves in order to protect others. This is the way we can combat this transmission of infection.
All right. Dr. Shetty, many patients, of course, have to still undertake a travel, some in public transport, to be able to reach and access clinics, OPDs or hospitals. Is it safe? What are the kind of steps that they should be taking, while, of course, they access a hospital or a medical facility?
Yes, a short answer to your question is it is not safe. As far as possible, one should avoid public transport if at all possible. But I do understand that for some people it is not possible to avoid public transport. In that case, they should be very, very careful. They should wear a tight-fitting face mask and try to maintain as much as possible social distancing during the travel. But in congested trains and buses, it can be very difficult. While traveling, they should not be touching their nose, mouth, or eyes. It's very important to avoid this. And after reaching home or their destination, they should wash their hands thoroughly with soap and water, or at least use a sanitizer. This is very important because it's possible that while traveling in a public transport, you are touching so many things where there is a potential for getting an infection. So this is very important. And it's also important for you to avoid cash transactions during the public transport as far as possible. For example, you can get a monthly pass or something like that. So it is important to avoid cash transactions because there is also a small risk of transmitting infection through the fomites, although this is not the major mode of transport. The major mode of transport is still the droplets. So social distancing is the most important, and wearing the face mask is probably the most important.
Dr. Sinha, many people, of course, are at this moment scared to step out of their homes, post the lifting of the lockdown in several areas. How would you allay these anxieties? Do people still have anxieties that are associated with the lockdown? How can one deal with these anxieties, Dr. Sinha?
This pandemic has been one of the greatest anxiety raiser in the whole population around the whole world. And it is true that anxiety is present, and our psychiatrist will have, my psychiatrist friend will have to deal with more of these cases at present time also. And when pandemic ends, this will have a long lasting effect on the psychosocial aspects of minds of people. At present time, I would like to say that it is better to fear, better to take extra precautions when we come out, because although lockdown have been relaxed, but this pandemic has not ceased. The infection is present. We have to take extra precautions.
All right, Dr. Sinha, also, it's important as people step out, I think, to note that you should only step out if it is absolutely essential. I think that's something that needs to be highlighted and underlined as well. But Dr. Shetty, if I can come back to you, social distancing within office spaces. As people go back to work, many are still concerned about how to implement, social distancing rules within office spaces. Should there be cordoning off between desks? Should there be barriers? What's a safe workspace in a pandemic looking like?
So I think the answer is yes. If possible, you should put some types of physical barriers between the cubicles and increase the distance between the various workers. I mean, usually 5 to 6 feet distance should be maintained. So it's also important to reduce the number of people working in an office at a given time, because you may not be able to completely run the full house. So it's also equally important to educate people, because just having these physical barriers is probably not good enough. They should still be wearing the tight-fitting face mask, which is very important. And people have a tendency to ignore the social distancing norms in the office because they think that their colleagues are very safe because they know them. Actually, they do not. When they go out of the office, they do not know what they do, whom they contact with. So this is chance of getting infection from your colleagues. I think this has to be, the people have to be educated about this. It's very important to understand this.
All right. So physical barriers would, perhaps be better. But if that's not possible, at least distancing among people, should be maintained while, of course, you are in an office space. Dr. Sinha, I want to ask you, it's of course been, comorbidities has been talked about widely, that it increases the risk of COVID-19. What are the steps that can be taken to reduce the risk, especially when it comes to diabetes patients?
It has been seen that actual prevalence of infection in patient with diabetes is the rate of infection in patient with diabetes is similar to the prevalence of diabetes in the population, meaning to say that patients with diabetes mellitus are not having any increased rate of infection. The chances of infection in a person without diabetes is similar to a person with diabetes. But what has been seen that a person living with diabetes is having increased severity of this infection. So they are more likely to have hospital admission, need for ICU ventilators, and they may have adverse outcomes, especially when their blood glucose are not well controlled. The other aspect of this point is that if the blood sugars are well controlled, then the rate of adversity is almost equivalent or similar to a person without diabetes. So a simple message is avoid infection and keep the blood sugar well within the control. This will reduce any adversities that may occur because of the presence of diabetes mellitus.
Dr. Shetty, what about ACE inhibitors? Should they be used? Should they not be used?
So I think the reason why this came into some question is because of the understanding that ACE2 receptors are involved in internalizing the virus, that they may promote, for example, ACE inhibitors may actually promote the internalization of the virus. But it's not been true that there's no study has been shown to demonstrate this. So most of us feel that it is quite safe to give ACE inhibitors and the ARBs. In fact, the major professional bodies like American Heart Association and American College of Cardiology and the European College of Cardiology all recommend that it is safe to continue ACE inhibitors during the infection, because in some people with poor heart function, it may be unsafe to actually stop them. It may actually do more harm. So till we have any conclusive data that it is harmful, it is recommended to continue these medications for these patients.
All right, Dr. Sinha, there have been many questions that have been asked about, are there preventive vaccinations? In case a person has had a flu and has been given, a flu vaccine this year, is that person protected from the coronavirus?
Yeah, there has been notion among people that because if they are vaccinated with flu vaccines, and because this COVID-19 most likely presents as pneumonia, people believe that taking this flu vaccine could be preventive for COVID-19. But this is not the case, because remember, different bacteria, different viruses have different genomic materials, and they have different antigens. And due to these different antigens, there are different antibodies responsible to control the infection and the propagation of bacteria and viruses in our body. And that's why a vaccine meant for flu acts for flu, not for this, because there are different antigens and we require different antibody for different infection. Had that flu vaccine been working, we would not have been in search of a new vaccine for this COVID-19.
All right, so I think that clears the air as far as other vaccinations are concerned. We'll continue, asking you questions. We're going to slip into a very short break. Both Dr. Sinha and Dr. Shetty will continue to be live with us. To stay tuned.
Knowledge Partner, USV, your reliable healthcare partner.
Let your little light shine. Let your little light shine for the world to see. Let your little light shine for the world to see.
Oh, wait. Heads, I swipe. Tails, you swipe. Heads it is.
Look, a pink elephant.
What?
The all-new 6-seater MG Hector Plus. It's a human thing.
ले आइए Okaya होम इन्वर्टर बैटरी। इसकी एडवांस ट्यूबुलर टेक्नोलॉजी देती है क्विक रिचार्ज एंड लॉन्गर बैकअप। Okaya, never stop India.
नमस्कार। कोरोना के खिलाफ इस लड़ाई में सबसे ज़्यादा ज़रूरी है लोगों की जान बचाना, और इसमें मुझे आपकी मदद की ज़रूरत है। लोगों को प्लाज्मा मिलने में तकलीफ ना हो, इसके लिए दिल्ली सरकार ने भारत का पहला कोरोना प्लाज्मा बैंक बनाया है। अगर आपको ठीक हुए 14 दिन हो चुके हैं तो आप भी प्लाज्मा डोनेट करके किसी भी कोरोना संक्रमित व्यक्ति की जान बचा सकते हैं। और हाँ, घबराइए नहीं, प्लाज्मा देने में आपको कोई कमज़ोरी नहीं आएगी। किसी की जान बचाने का मौका बहुत कम लोगों को मिलता है। आज आपके पास ये मौका है। मेरी आपसे प्रार्थना है, आगे आएं और प्लाज्मा डोनेट करें।
The brick that I'm holding symbolizes the heartbeat of communities in the bottom of the pyramid. Join hands with Habitat for Humanity in rebuilding India brick by brick.
अब पापा का पेंडिंग बर्थडे गिफ्ट भी मिलेगा और जुम्बा क्लास के लिए नए जूते भी, क्योंकि अपनी दुकान में मिलेंगे आपकी जरूरतों के सारे सामान पूरी हिफाजत के साथ। बताइए क्या चाहिए? Amazon, आपकी अपनी दुकान।
कोरोना अपडेट। सब कुछ होने पर भी अपना हेल्थ इंश्योरेंस नहीं कराओगे? आज ही सही डिसीजन लो मैक्स पुपा हेल्थ इंश्योरेंस के साथ। 30 लाख तक का कवरेज सिर्फ 620 रुपीस पर मंथ में। अब नहीं खरीदोगे तो कब?
Amity has been ranked India's #1 not-for-profit private university for 7 years, with top 10 ranked institutions in management, engineering, biotech, law, mass-comm, telecom, hospitality, fashion and more. Yet another top ranking for Amity University.
Welcome back. We're having a conversation with some of the brightest doctors answering various questions on dealing with the new normal. Dr. Shetty, if I can come back to you at this moment, for patients who are awaiting elective surgeries, what would you advise them? For a brief period of time, all elective surgeries were in fact called off. Now there's a mandatory COVID test before. What about elective surgeries? Should they or shouldn't they be done?
We are still in the middle of the pandemic, so a truly elective surgeries, like for example, a knee replacement surgery or an uncomplicated hernia, such surgeries can still wait. But there are situations where sometimes the surgery is not emergency, but at the same time, you cannot wait for 6 months, 1 year and all that. Like for example, patients with critical multi-vessel blockages, coronary artery disease. So where you need a bypass surgery. So I think in such situations, one should probably go ahead with the surgery. And in hospitals who are following strict protocols and mandatory COVID testing, I think it appears to be pretty safe. I don't think you should be postponing all elective surgeries because of the pandemic, because we don't even know how long this is going to go on.
Right. Dr. Sinha, is there anything that you'd like to add about elective surgeries? What are the kind of surgeries that one can hold off and for how long, and what are the surgeries that one shouldn't delay?
I think sir has rightly described that all those surgeries that are emergent, that have a serious impact on patients' health, they need to be carried out. And those surgeries that can wait, that do not have much implications on the quality of life of patient, they can be delayed till situations recover, or we have better arrangements and segregations of COVID patients and non-COVID patients.
Right. Dr. Shetty, just speaking of elective surgeries, because there's such a, large number of people who are probably waiting, to get surgeries done. Is it normal procedures that are followed? I mean, except of course for the COVID-19 test. What about an attendant, in case it's a small child, or it is an elderly person who needs an attendant? Are attendants for patients allowed to stay with them in hospitals despite the pandemic?
I think it depends on the hospital policy, because some of the hospitals have enough staff to monitor these patients in the post-operative period, but other hospitals may not have, and they may depend on some of the patient's attendant for help. So I think it doesn't change very much. However, after the surgery, it is important to restrict the number of people visiting these people. Right. No question about that.
Dr. Sinha, is there anything you'd like to add, in terms of emergencies? What happens in case of an emergency, especially, in heart diseases, one does see a lot of emergency patients coming in. What's the protocol that is then followed? Do you wait for a COVID-19 negative test to take place? Sometimes you may not have a window where you can actually wait for a test. So what happens when a patient is rushed in an emergency? Could be an accident, or could be any medical condition.
Yeah, whenever we face such emergencies, where time can be important, it is generally followed that the emergent procedure is done without waiting for the result, but all the precautions are taken considering that the patient may be having actually COVID-19 positive.
And Dr. Shetty, what is the difference? When you can wait, when you know that the patient is COVID negative, of course, the surgery procedure, I'm guessing, is as per normal. But when you don't know, or in emergency cases, when you don't have the luxury of time to wait for a COVID negative result, what are the protocols that even doctors should follow and keep in mind?
So I think when you are doing an emergency surgery and you do not know the COVID status, it is very important for us to take 100% precautions in terms of wearing PPE and keeping the distance and everything else. So it is like you have to assume that the person is COVID positive. So that's how you should be treating such patients. Obviously, patients who are coming with a heart attack and a complication, for example, they may not be able to wait for the COVID test results to come. Sometimes we do choose alternative options like medicines where they may have a reasonable chance of getting a good result. For example, patients coming with heart attack within the first 1 to 2 hours, 3 hours. Previously we took them to angioplasty, but now sometimes we may think that thrombolytic therapy may be an alternative option for such patients. But however, in case we really think that a procedure is important and life-saving, we will not withhold that. We will follow all the protocols as if the patient is infected.
All right, Dr. Shetty, if I can also ask you, about, once again, because we're talking about elective surgeries and there are so many different people with different kinds of surgeries, that are in fact scheduled at a time like this. What happens if a person who's admitted into the hospital for a scheduled procedure and that person has then tested COVID positive? Do you then send them to a COVID hospital? Do you still go ahead with the process? How does it work?
No, I think if a person is COVID positive, you should not be doing any elective surgery. Okay. That doesn't make any sense because that does expose the staff of the hospital to the risk because you are, especially if you are giving anesthesia and intubation, ventilation is done. Moreover, you don't even know the outcome, how this virus is going to behave in such patients.
But Dr. Sinha, in that case, do you ask patients to come with the COVID negative certificate or do they get admitted and then get a COVID test done?
The protocol is different in different hospitals.
Right.
Generally, patients are admitted here and then we ask for COVID results and act accordingly.
Okay.
So it is always patient's perspective is kept in mind how they can be benefited in this pandemic time, whether it is emergent procedures, non-emergent procedure or elective procedures.
All right, so different processes are followed by different hospitals. I'd just like to take closing comments, Dr. Shetty, from you first. Any special advice to vulnerable patients, those with diabetes or heart conditions? How can they manage their chronic conditions at a time like this? What about diet, exercise, medication follow-up? What advice would you like to give them?
So in patients with chronic diseases like high blood pressure, diabetes and coronary artery disease, it is important for them to continue their lifestyle, good lifestyle, diet and also the medications during this period because one of the excuses we hear is that they are not able to exercise because of the lockdown or because of just the fear of going outside and catching the infection. If you are wearing a tight-fitting mask, I think walking outside is reasonably safe unless the area is very congested. I think it is important to continue some type of physical activities. If you are not able to go really outside, but you can do lots of physical activities indoor. So, you may turn to yoga or something else. It's important for everyone to keep doing some exercise even during the period of lockdown or for whatever reasons you do not want to go outside. And as far as the diet is concerned, again, the same thing. And you should not be relaxing because you are, mostly indoor. The chances of you eating more is there, but I think one should follow the discipline. If you have any questions or if you have any symptoms, you please do not hesitate to go to the hospital if necessary, because video consultation may not be a complete solution for all the problems of the patients.
All right,
So
Dr. Sinha, anything you'd like to add?
My message to patient living with diabetes, as I see more patients living with diabetes, that stick to the basics, avoid infection, and try for better control of blood glucose. If you cannot come to us, take the facility of audio call, video call, whatever it is. We are there to help you. And my special message to children who are living with type 1 diabetes mellitus, keep a good stock of insulin. Always follow the sick day rule, meaning to say that when you fall sick, do not omit the insulin. Check blood sugar regularly and check for ketones when you are falling sick, because that may have any implication and may land up in emergency if it results in diabetic ketoacidosis. So stick to the basics, keep the blood glucose under control, keep hypertension under control. That will reduce the adversities that may be associated with this COVID-19 infection if we get it.
All right, Dr. Sinha and Dr. Shetty, thank you so much for sparing the time of day, and you've been very patient and kind in answering all our questions. But that's, I think, very useful, pertinent advice in terms of disease management, other chronic disease management in the time of a pandemic. Very useful advice there coming in from both our doctors. Thank you so much for joining us, and thanks for watching.